Hello, my name is Dr. Kate Oga. I'm a medical doctor and a consultant microbiologist. I've been practicing microbiology in the UK for the last 19 years. The remit of my job allows me to treat patients with various types of infections, with COVID-19 being one of them. I thought I'll give you a bit of a scientific background to the coronavirus just to help you understand it a bit more. The coronavirus itself has been around since 1937. It was first isolated in chickens. It infects both humans and animals. The human coronavirus was first isolated in 1960, mainly associated with symptoms of common cold. In fact, 50% of all common cold is caused by the coronavirus. So most of us would have encountered the coronavirus at some points in our lives. It wasn't until 2003 when coronavirus went on to cause quite severe infection. And the first infection, severe infection in 2003 caused by the coronavirus is known as the SARS infection. It started in China. It was also traced back to bats. It infected over 8,000 people, with over 700 deaths. That infection completely disappeared off the face of the planet in 2004. We no longer have the SARS virus. The second severe infection caused by the coronavirus is the Middle Eastern Respiratory Syndrome virus, known as the MERS infection. It happened in the Arab Peninsula, and it infects people when they come in contact with infected camels or when they drink infected camel milk. Now, that infection is still ongoing. The mortality rate associated with that particular MERS coronavirus is pretty high. About 35% of people who get infected die. Compare that with the COVID-19, which causes only 3% mortality rate. So, the COVID-19, first declared as a global emergency by the WHO in January 2020, has so far spread across the whole world, and there's practically no country in the world right now that does not have cases of the coronavirus. So even though the mortality rate is pretty small, it causes quite a contagious infection that spreads very, very quickly. And that's what is frightening about the coronavirus. The fact that it can spread very, very quickly from one person to another. How do people get transmitted or get infection? How do you get infection? The infection is transmitted from person to person through coughs, through sneezes, even through talking. So if somebody coughs or sneezes and you're within 2 meters of that person, you can get infected. You can also get infected when you touch contaminated surfaces and then you touch your face. This virus has a predilection or can infect your respiratory tract very, very easily. It has spikes on the surfaces known as receptors. This is what makes it look like it's wearing a crown, and that is where it gets its name, the coronavirus. These receptors bind to your cells in your epithelial tract or the respiratory tract, and that is how it mainly causes its symptoms. It binds to the respiratory tract. What are the kind of symptoms that this virus can cause? 80% of patients who get infected have only mild symptoms, but about 13% of people who get infected will go on to develop severe infection. What are the symptoms? Fever, cough, mainly dry cough, but some patients produce sputum. Shortness of breath, which is difficulty in breathing. Some patients have sore throat. Some have headache, generalized body pain, diarrhea, vomiting, nasal congestion, and there are symptoms that affect your ability to taste and your ability to smell. Those are all symptoms that have been attributed to the COVID-19 virus. Now, the incubation period of this virus is anything between 2 to 14 days. So if you get infected or if you come in contact with somebody who's infected, it may take as little as 2 days or as much as 14 days for you to come down with symptoms. And the symptoms I've already listed. What is the treatment for COVID-19? There is no proven treatment. There are trial drugs that we're currently experimenting with. One of them is an antiviral that was meant for the treatment of Ebola. We're currently using that to treat some patients. We're also treating some patients with a combination of anti-HIV medications and also chloroquine or hydroxychloroquine, which is an anti-malarial drug, has been used to treat patients with COVID-19. None of them is proven to work yet. So as I speak, there is no treatment for COVID-19, but there are trial or experimental drugs. When patients get infected, one of the symptoms is the inability of the body to be oxygenated. So they take in breaths, they find it difficult to breathe, and then oxygen doesn't get into the tissues or doesn't get into various organs, and that's how they get into multi-organ failure, and that's what ultimately leads to death. Any person is susceptible, but people that are most at risk of the infection include the elderly, patients who don't have a good immune system to fight the virus, patients who are obese, patients who have something already wrong with their respiratory tract. Maybe they have, what we call COPD or asthma. Those patients are more at risk. Another group that's more at risk are the hypertensives and the diabetics. There is no age group that is exempt, although children tend to be less infected than the elderly. But we have also seen deaths occur in children, so no age group is exempt. How do you protect yourself? The best way to protect yourself is to stay away from potentially infected people, which is why most governments are advising their citizens to stay indoors. The idea is that by staying indoors and preventing the spread, the virus will ultimately, disappear from the community. Having said that, there's no guarantee that when things come back to normal, that the virus will not re-emerge. So there is a race to discover a vaccine to use to protect people so that life can go back to normal. We do not have any treatment at the moment. So keep safe by staying indoors, by washing your hands. Now, some people have